I appreciate you joining us, Dr. Brown. My name is Billy Ball, managing editor of Cardinal Pine, and I'm coming to you live from Durham, North Carolina, where, like the rest of the state, we're all locked away at home, as you could tell. So first off, welcome. Thanks for joining us, Dr. Brown.
Thank you.
So I've got just a few questions for you. Obviously, this is a big day in North Carolina and beyond North Carolina. About 2 minutes ago, we had a group called Reopen North Carolina that began its rally to reopen the state. They are protesting the current social distancing orders that are in place in North Carolina under North Carolina Governor Roy Cooper. And this comes a few days since epidemiologists, including those with RTI International, told Governor Cooper's administration that we can expect to see a tremendous increase in infections and the possibility of overloading our hospitals if all of our social distancing orders are lifted at the end of this month. So I wanted to ask you whether, at this point, is that guidance still something that epidemiologists are passing along to the governor, or has something changed?
Well, I don't know who's passing what to the governor, but Dr. Fauci said exactly the same thing last night to the nation and to the president, that if you don't maintain social distancing, you're going to get an increasing spike in the number of cases. So, I think the whole issue with opening businesses is how can businesses reopen and maintain social distancing and disease prevention strategies. This virus is like nothing we've seen in recent years. So it is obviously very contagious. It's also appears to have a large reservoir of people who have the virus but do not present symptoms that we assume can be transmitted to others. I think the real problem is there's so many more questions about the virus that we don't know than we do know, that it'd be really foolhardy to expose the whole population again without some prevention strategies. I know businesses are, and the president even talked about himself, of a strategy to roll out something, maybe begin with a small percentage of employees going back and being able to maintain social distancing, have them have some kind of protective equipment. People going to these stores should have protective equipment. So, and then of course they talked about testing, so you know who's exposed, and we're not there yet. So you're gonna have people who are carrying the virus going into these establishments, not only, or people working in these establishments carrying the virus. And so you have people infecting other people and their families and the population in both directions.
What would you say to the folks who are protesting right now in Raleigh? I don't have any numbers on how many are out there, but we'll have some of those later in the day. But right now they're saying that, the cure is worse than the disease is the type of thing that we're generally hearing from folks who side with groups like Reopen North Carolina. Is there anything you'd like to say to them?
I don't think they would think it's worse than the disease if they or someone in their family was put on a ventilator in a hospital or died. I hate to bring it down to whatever, but, Boris Johnson in the UK was pretty nonchalant about thinking about this virus, going around shaking hands. And what does he do? He ends up in the ICU. We haven't heard comments from Boris Johnson lately about this is not a problem. So, I think if it hits them or their families or people they love and know, it would be a different story. Right now it seems like, it's not going to touch me. But I think when it touches these people, you understand that this is a big unknown virus. We don't know if it's going to get better. We don't know if it's seasonal. We don't know. But, following an epi curve, if the virus is still here, people go out in public, they're carrying the virus, we're going to generate a new curve. We do not have herd immunity in this population. Even if some people have been infected, to get herd immunity, you need like 95% of the population to be carrying antibodies to something. And we just don't think we're there. There will be antibody testing. If it turns out at some point everybody is immune, yeah, then it would make sense to open businesses. But if you can still transmit the disease at these high rates, it doesn't make any sense to me at all that you would want even to be contributing to that.
Mm-hmm. Yesterday, Dr. Mandy Cohen, who's the Secretary of North Carolina's Department of Health and Human Services, said that with the vaccine 12 to 18 months away at least, that our best tool for fighting COVID-19 is the social distancing guidelines that we're talking about now. You think that's a fair way to sum it up?
I mean, I know they're trying to move the needle on the vaccine, but you're right. Until there's some way to prevent people, you have to keep people away from other people.
Mm-hmm.
You know, it's like, even, in the old days where we fought chickenpox and measles, I mean, unless you wanted your kid to get chickenpox, you didn't invite other kids over. If you wanted to get chickenpox, you had them come over, Mm-hmm. So, those diseases were also quite infectious, but, it's you could control it somewhat. I mean, some of the measles epidemics got out of hand because people weren't getting the vaccines, but this one, because the asymptomatics, I think it's a whole nother story here. Mm-hmm. And the whole range of symptoms and that we didn't even realize were tied to COVID. Mm-hmm. I mean, this virus is a mean little thing. So, anywhere from no symptoms to death. I mean, it is a huge range, and the people that are getting it, some of our most vulnerable populations that we need to protect. So,
mm-hmm. Is it too soon to say that to set a certain deadline for when we think that people can reemerge and businesses can reopen? Is it too soon to say that?
Well, I think the president is trying to say by leaving it up to governors that these places are different, but we have a global economy. We have economy. Once you start trains and buses and airplanes, there's no way to isolate your state, right? Mm-hmm. So maybe you say, oh, okay, my little state is safe. But if you start having businessmen from your state travel to another state that has, more COVID or something, you're just going to be seeding your state. So, even if we close our borders and all that stuff, I mean, unless we, some little county wants to open and puts a fence around their county and said, okay, you can open your business, but you can't let anybody else inside from outside your county or outside your state, it doesn't sound realistic to me.
Mm-hmm. Mm-hmm. Now, in this moment, we're hearing about other states, neighboring states like South Carolina that are talking about opening up. How do you see this impacting states like ours, like North Carolina, when you see border states that are beginning to reopen businesses?
Yeah, well, that's a problem, especially if people either from South Carolina come to North Carolina, or North Carolina people go to South Carolina or Georgia, or the people on all the Florida beaches. Mm-hmm. Yeah, no, it's definitely problematic. I mean, we are not an isolated country. We are all interrelated. So I think that's, why they formed a big consortium in the Northeast. They have 7 states that are working together that are all borders. The DC area, we have, DC, Maryland, and Virginia all bordering together. Mm-hmm. So I don't know if North Carolina as a state is working in isolation or if they're working with their state partners, but, I would think the governors would want to talk to each other.
Uh-huh. Okay. Now, last question for you. And again, thank you for joining us today, Dr. Brown. What's your advice for people who are sitting at home right now and they're just going stir crazy, or they say, we're done with all our yard work. We'd like to see something get going again. What's your advice for those people right now?
Well, personally, because I'm, an older American, I do not go out. I go for a walk. I walk along one of the neighborhood streets where there's a wide road, right? And so even if you pass somebody, you got 10 feet between you and the next person. Mm-hmm. So you can get exercise. I'm lucky enough to have my own exercise equipment in my house as well. Mm-hmm. But, there's people, you can go to your backyard if you you're in North Carolina. A lot of places, probably, unless you're in downtown Raleigh or something where you're going to be more restricted like New York City, there are probably places where you can go out and get into nature and get some fresh air. I mean, it's not like we're in the middle of winter.
Yeah.
But, and they do allow you to go to the grocery store and stuff, and you can do that if you protect yourself and protect others. But, I personally, I am contributing to the economy by having others shop for me and paying them, because I can afford to do that. Other people can't afford to do that. But, I personally am trying to keep my social distance because I don't want to end up in the hospital and I don't want to contribute to anybody else getting the disease. So I think people just have to suck it up, basically. I mean, this will pass, but if you get sick and make other people get sick and end up in the hospital or on a respirator or die, then because you couldn't enjoy life to its fullest, you'll never enjoy life.
I understand. Well, again, Dr. Brown, thank you for taking the time to join us. And we will keep a close eye on this as the data comes in and the epidemiologists continue their work. And as North Carolina's governor continues to consider what we should do with our stay-at-home orders in the coming days. Thanks for joining us.
Yeah, I mean, I think people have to realize it's not just themselves. This is not a time to be selfish. They have to think of, the broader community.
Okay, excellent. Well, thank you again. Stay safe, stay healthy.
Thank you, you too.